Eating disorders were once thought to be a problem that was most common with teenage girls. However, medical research is now finding that there are many factors which constitute eating disorders. Here is Dr. Ted Williams at St. Joseph Hospital in Orange to explain these findings.
When your relationship to food interferes with your life seriously. Now that can be restricting your food, or you can even be overeating where it results in obesity. What we do at this hospital is treat the anorexics and the bulimics. The compulsive overeaters, or the people that are markedly obese, can get treatment through other kinds of nutrition and diet programs and so forth. And also there's the surgeries that they're getting more and more also for the morbidly obese. What we're focusing on in our outpatient eating disorder program at St. Joseph Hospital is the anorexic, the people that really severely restrict their food intake to the point where it's endangering their health, or the bulimics, which means that they can binge and then usually purge, either by vomiting, self-induced vomiting after a food binge, or they can purge by way of laxatives. Some of them use diet pills excessively. The most common onset is a teenage girl. The incidence of anorexia and bulimia is probably 9-to-1, females over males. The typical anorexic or bulimic patient who's focused on maintaining control and low weight with the rigor of exercise and so forth tend to be perfectionistic type young women. And there are control issues that are at the core of this, and very often in struggles with family members, particularly parents, sometimes relationship with a spouse or significant other. So families need to be involved, or significant others, in the treatment also. At the treatment, we firstly have to bond the patient to the treatment team so that they don't feel threatened. And very often the intervention is the toughest part, because family members will call and say they have a daughter that's way too thin, and they're concerned about her health, they're concerned about the way they relate to food, and or they have signs that the person has been vomiting and hiding the evidence and so forth. And so they feel very threatened, the person that's involved in the eating disorder, as I said, of gaining weight. So the denial is a huge issue, just like with alcoholics and drug addicts. You know, initially there's a denial. They don't want to admit that they're out of control. So you have to bond them to a treatment team, and then you have to go very slowly. Medications are very important. It's a compulsive disorder. It's kind of at the one end of an obsessive-compulsive spectrum of behaviors. It's obviously out of control, and so some of the medications can be very helpful to break that compulsive pattern. And then you have to work on the nutrition, a diet plan that they will agree with. We have a dietitian that works with them very closely, very well trained in eating disorders, and a team of therapists. And it takes an intensity. Sometimes they have to go into an inpatient setting because they can't be monitored closely enough as an outpatient between therapy visits. At the hospital, we have a day program where they come in every day, except weekends, all day, with guided eating exercises, monitoring their food intake, compliance with medication, things like that.